Please note today's session is being recorded. If you have any objections, you may disconnect at this time. Thank you very much, and on behalf of the National Cancer Institute, I wish to welcome everyone to the June Advanced Topics in Implementation Science webinar. Today we are delighted to welcome Drs. Samaticus, Shelton, and Craddock Lee, who will be joined by our own Dr. David Chambers to this campfire session. A brief word about logistics and we'll be off. We ask that if you are not already on mute, to please keep your phone on mute for the duration of today's presentation. As mentioned, the session is being recorded, and muting all lines will help us to avoid any background noise. We encourage questions. They can be submitted using the Q&A feature on the right-hand side of your screen. Type your question in the provided Q&A field and hit submit. Feel free to submit your questions at any time. We will be moving through your questions and some we have for our guests throughout today's webinar. And with that, I will turn it over to David.
Thank you, Sarah. And here you see the smiling faces that we are able to learn from today. For those of you who haven't attended these series of webinars that we've had, this has been our attempt to move a little bit away from some of the more didactic sessions that we did in previous years to have more in-depth conversations with various leaders, and in this case at different stages of their career. We found that the ability to learn from the wisdom of those who entered the field at a particular point and what they found there, how they've seen the field of implementation science evolve, and what advice they have for others who are following in their footsteps has been really well received by our community. And we think that today's session is a wonderful complement to those that came before. We started out in the dead of winter, I guess, with the fireside, and now as we are finally in summer, although those who've been tracking temperature might feel like we got there a little bit ago, we move more to the campfire. And so again, the idea of this is to be more of an informal conversational opportunity, both to learn from those folks, and I have a set of initial questions to get us going, but then also to feature your thinking and what you would like to hear from our esteemed guests. And as Sarah had indicated, we have three wonderful earlier career investigators, I would say, with us, Katie and Simon and Rachel. So just a few words. So Katie was actually part of our first Training Institute for Dissemination and Implementation Research in Health back in 2011, and at the time I believe was at WashU and is now assistant professor at St. Louis University. Katie's work has really focused on trying to understand evidence-based practice implementation within public health and learning from the experiences of those working in local health departments to give broader insights that help us as we think about how do we move our evidence base to the benefit of public health practitioners. Simon Craddock Lee, who joined us in 2012, the second edition of TITRE, which was over on the West Coast in San Jose, I believe, was a cancer prevention research fellow here at the NCI, is, as you see, at University of Texas Southwestern Medical Center, and his work has focused on screening and survivorship in underserved populations. He's also played some leading roles within the CTSAs in thinking about community engagement. And we're grateful for his participation as well. And then you'll see on the right, Rachel Shelton, who was our part of our fifth cohort in 2015, which was again in California, in Pasadena. And Rachel, who is at Columbia University at the Mailman School of Public Health, has worked a lot on the roles of lay health advisors in reaching underserved populations, has also focused on communication and decision-making to try and motivate better care for colon cancer patients, and has had a particular recent focus in thinking about how do we advance our understanding of sustainability. So welcome to the three of you, and thanks so much for joining. Want to get it kicked off with a sense of, for each of you entering the field, what was it that inspired each of you to pursue work? Why did implementation science call out as an area that you wanted to receive training and dive into? And as I see Katie and then Simon and then Rachel, why don't we go in that order? So again, in chronology of TITRE. And here you see the first of our many campfire scenes to come. So Katie, do you want to tell us a little bit about what led you to work in implementation science?
Yeah, thank you, David, and thanks for the explanation of that picture on the scene. I was afraid I'd have to try and explain that. So I think what initially inspired me was that I was seeing from the public health side of things that so much of what seemed to be successful in public health interventions seemed to be very setting specific, and it made me start to think about context in a different way and wonder if there were certain features of implementation settings that could themselves be modified to improve successful programs and then ultimately community outcomes. And then also I had mentorship in D&I early on, some senior people that were already working on dissemination and implementation science, and so I had inspiration from some senior researchers, and that really helped spur me on.
Great. Simon, you want to tell us a little bit about your entry into the field?
I stumbled into implementation science and dissemination, or at least D&I, from that perspective. I mean, as an anthropologist, I went through a bit of a crisis of conscience leaving the NCI and coming out to an academic medical center where, you know, the days of purely observational R01s are probably long gone, or at least few and far between. And anthropologists have this sort of prime directive thing that we joke about, which is we watch and we don't intervene, which means that that really limits what you think you're doing in proposing an R01. And I realized that people call dissemination and implementation different things in different traditions. So we've talked about in Canada, the language that they use for knowledge transfer, but I stumbled on it by thinking about evaluation in anthropology, where applied anthropologists do a lot more in evaluation. So the idea for me was, without giving up the methods that I feel like I have the strongest grasp of, that I could evaluate before, during, and after an intervention and assuage my sort of initial gut reluctance to engage in intervening, but then I had to think about who could partner with me to help think through that.
Gotcha. And Rachel, same question for you?
Sure. So I think two things came together to really inspire my work on implementation science. So one, during my doctoral studies at Harvard, I did a pre-doctoral fellowship in cancer prevention and control at Dana-Farber Cancer Institute. And I was really fortunate that a lot of the early leaders in implementation science were based there. So I think as early as 2007 or 2008, I attended a day-long training on the topic, and that really got me inspired. And there were national leaders from the field. And I think that was eye-opening for me, that there was this whole other layer that I wasn't considering when I was thinking about social and behavioral interventions. So there was that piece, kind of the mentorship and inspiration. And then when I did my postdoctoral work at Mount Sinai School of Medicine, I started doing a lot of work on lay health advisor and patient navigation programs. And I developed this great partnership with the National Witness Project, which is this community-based, evidence-based lay health advisor program that was one of NCI's RTIPs, the Research Tested Intervention Programs. And my research was really driven by their need. They were finding that they had huge issues in implementing and sustaining the program, you know, despite their success. And it was really important to them to understand this better. So I pulled together my resources and wrote an R03 that was funded. So I kind of rolled into it, you know, partly because of their interest and need, and really developed my research program from that. And at the time, I didn't really have the language or training in implementation science, but I think in effect that's what I was working on, and then kind of developed that as I went.
Cool. Yeah, so it seems like, again, each of you had slightly different starting points, and also it seems like when you entered the course, the specific tighter training, each of you were at a little different point in terms of your familiarity with some of the terms, some of the you know, some of the concepts, some of the tools and resources. And so along those lines, I just wanted to get a sense from each of you of how have you perceived, since entering the field, how do you perceive that the field has changed over those years of working in it? Maybe we'll go back to Katie. Do you want to kick us off? We'll go sort of same order, Katie, and then Simon, and then Rachel.
Sure. So I guess, you know, thinking back a few years, it seemed like a smaller field early on, and because of that, I think there was a lot of focus on it being an emerging field, and it seemed like a lot of a lot of kind of self-reflective discussions happening at D&I meetings about the fact that it was an emerging field. And then all of the things that go along with that in terms of maybe fewer established experts from whom early stage investigators might seek mentorship, a perceived and perhaps real lack of institutional supports, particularly in academic settings for doing D&I research, inconsistency in terminology, and and then as far as methods, an expressed need for research designs other than RCTs and ways to approach the inherent complexity in delivery systems that D&I work targets. And so I think those were some of my reflections of kind of where the field was early on, and I think some of those have changed. I mean, the terminology, I think still is something that the field struggles with to some extent, but has become more consistent. I think there are ways and a lot more examples now of people that have been successful doing really rigorous work and recognized for doing rigorous work that doesn't necessarily fit in that RCT gold standard framework anymore. So I guess those are some of the changes that I've seen.
Gotcha. Great. Simon, your thoughts?
I'd agree with that. I think for me, what impressed me was the sort of explosion of interest in measures and within that, or I guess above that, a much deeper approach to thinking about how you frame where your research question is within the continuum of, say, healthcare delivery. So the interest, I think, in trying to advance that rigor was balanced by, I think, a lot more nuance in slicing up the continuum and recognizing that there were a lot more unanswered problems than I think I certainly had initially realized. And the challenge, I think, for me has been balancing the rigor of advancing an implementation science or a dissemination science without losing track of the reason we want to implement in the first place, which is to change practice, but to change practice in the right way that's evidence-based, that's therefore replicable and generalizable. But I think the nuance in the efforts at measuring and thinking about the larger frameworks within which you approach your research question has really exploded.
Cool. Rachel?
So I think I originally got involved in the field around 2008 to 2010, and I agree, like at that time there was a lot of initial excitement about the field, and I think the field is really just growing and defining itself. And I started a course in 2013, and I remember I was so excited that there was a textbook that had come out, Ross Bronson's textbook around that time, because it really helped me coalesce a little bit more in terms of definitions and methods, and I really feel like that's around the time where it really started to coalesce a bit more. And I've really noticed, in the last 5 years, it's really grown from being this, smaller niche area to one where really everyone across disciplines and topical areas, I feel like there's an interest in, really expanding work in this area. And there's definitely greater institutional commitment from schools and deans to department chairs and faculty. And I feel like on a regular basis now, I'm really approached about different opportunities to get involved. And I've even seen in my course, it was originally mostly health promotion and PhD students, and now I have people, postdocs, epi students, health policy students, people from the medical school. So it really signifies that there's really interest across disciplines and across topical areas. And I agree. I think that while there's still room for improvement in terms of kind of coalescing around the terminology and the methodologies and the theoretical frameworks and models, I do think there is an evidence base that's really developed a bit more around what works.
Great. And so given that we have a fair number of representatives across the field listening to us. Each of you, as you've said, has seen the field grow, and this is your chance, certainly, to give your sense of what you see as particular priority areas for research that you'd like to see the field undertake. So I would love to get each of your takes on what would you see, particularly for folks listening or others, what would you encourage people to be thinking about for that next set of research studies? Why don't we start with Simon, and then we'll go Rachel and then Katie.
I knew there'd be a switch there.
Yeah.
So I think I'm going to cheat and go back to something that Katie said, though, because I think, the issue of trying to define the field, I don't know if it fits right here, but the lead into where I'm thinking is I think that if we can be sort of practical for early stage investigators, there's sort of two different phenomena of trying to get funded by NIH, and one is recognizing that the program announcement that's calling for dissemination implementation research is different from the study section called Dissemination Implementation Research in Health. And I think in terms of establishing the field, there was a really big push early on to create that evidence base and demonstrate that D&I was a real thing with a rigorous science behind it. But I think, and the fastest way to do that, for example, would be to push cluster randomized trials. But I think I'm really eager to see more work, as Katie said, tying back theory to quasi-experimental designs that I think really help us vary in how we think about applications in particular settings, because not everything is ready. We don't necessarily know enough about how an evidence-based intervention is going to work in a particular setting to then start running towards looking for data for generalizability. So I think trying to parse your research question and decide what is it you're in the next 3 to 4 years trying to solve or at least shed light on, because we can't do everything in each grant application, but I think trying to be very clear about what your goals are would really push the field forward.
Okay, gotcha. And so, Rachel, thoughts on the same theme?
Yeah, and I actually agree with Simon there. I was just doing a review on factors that influence sustainability across settings, and I think initially, previously we just thought kind of broadly what factors influence, but I think it's really important, especially for early stage investigators, like Simon said, to start to develop what's their setting focus going to be. Is it going to be more community? Is it going to be more clinical? Because I think those are very different in terms of what implementation science looks like and is carried out. So I do think that's an important point. I think one really important issue that's been evolving over the course of this field developing is this tension between adaptation and fidelity. So, we've traditionally seen this idea that you have to keep the core components with strict fidelity, but there's really been growing consensus that some adaptations of evidence-based interventions might be beneficial, particularly for sustaining interventions. So I think a really important question that's going to involve a lot of, I think, partnerships across faculty members and across systems is to start to understand and tackle this question of what kinds of adaptations are useful and which ones are detrimental. I think that's one really critical area. And the other really critical area I think that's been kind of wrapped up in dissemination and implementation science, but not always pulled out separately, is sustainability. I think it's often thought of, we'll follow up in 1 year and see what's happened, but I really think that the field needs to invest and understand much more in terms of what the long-term impact is of evidence-based programs, what can sustain them, and as the scientific evidence evolves over time, how do we think about, again, de-implementation or de-adoption of what's not working? So I think those are important questions that the field needs to tackle that, we don't have a lot of answers for, so those are areas that are kind of ripe for early-stage investigators to start focusing on.
Katie, your thoughts?
Yeah, I guess I have maybe two different ways of answering the question, and the first I think also relates back to what Simon was saying. So as far as priority areas for research, the major emphasis of the field is really testing D&I strategies, and then thinking about early stage investigators. This may not be something that's immediately feasible for an early stage investigator to jump right into. There's a lot of formative research that has to be done perhaps before you're ready to test a particular D&I strategy. And so as far as research and funding priorities, I think making sure that some of that formative research, that it's prioritized, that there's room for and then I think in my field, one of the things that I've been really excited to see as far as change is that that I see in population health and public health that D&I is really starting to become more integrated with intervention work and integrated with other theories of behavioral change that are now expanding frameworks beyond interventions that act solely on individual characteristics and individuals to lead to behavior change, but also, looking at the context of implementation settings and where those individuals might be aggregated, or the prevention settings that they may come in contact with through certain interventions. So I'm excited to see how that continues to develop.
Katie, thank you so much for that answer. I'm just going to jump in and remind our participants, or our attendees rather, that you can submit your questions using the Q&A feature on the right-hand side of your screen. We do have more speakers today, and so in order to sort of give you as many perspectives as we can on each question, we want to make sure that we are receiving those early and often if you have them, so feel free to submit. We have more questions for them, but we'd love to hear from you all as well.
Yeah, absolutely. And while you're thinking of those and while you're typing them into the Q&A feature of the website, one of the reasons why we thought it would be particularly helpful to have and thank you for our first person who has already sent it in, and we'll get to that. For the three of you was that you each applied for and completed training in dissemination, implementation research, implementation science. Wanted to have a sense from you as we're into summer, we're in the midst of certain summer training institutes, we're also looking ahead to the next version of our tighter training, to learn from you in terms of those experiences of completing that training. What sticks out from your training experiences is helping you to move your ideas forward, and are there specific lessons that you've learned that you feel like through that training improved your success in getting research support? Why don't we start with Rachel, and then we'll go to Katie and then Simon?
Sure. So I did the 2015 training. And honestly, I had doubts about applying originally because I had developed a course in this area years before that. And I was always doing work in the area. But a mentor of mine had convinced me that it would be really critical because of the kind of the in-person relationship building. And I'm so glad I did. It was honestly one of the best mentoring experiences that I've had. I think the in-person and not only developing relationships with peers, but the mentors and the leaders in the field and the program officers was really, really critical in terms of me just feeling more comfortable asking questions, feeling like I knew the content, getting the in-person feedback on my aims, being able to go to leaders in the field and ask them to be co-investigators or consultants on my studies, or even just bounce off ideas or strategize. So I think that really gave me the confidence that I knew the content, but that I could also approach them and that I had those relationships in place. And I think, again, just having that in-person commitment and getting feedback on the aims, even though the project really developed after the tighter training, I was still able to kind of reach out to them and work with them over the course of the year before I submitted my R01, which was so, so helpful. And then I think it also gave me credibility as an expert within my institution. So I think part of the mandate of the tighter training was that you really come back to your institution and, kind of present yourself to the school as, I'm here as this resource for you, doing presentations on it. And I think that this really allowed me to kind of have the credibility again to be an expert within my institution, and it gave me a platform for doing so. So I really appreciated those aspects of it.
Katie?
Yeah, I think for me, the tighter training really, so at that point, going back to 2011, I had started doing some work in public health systems research, and so what tighter gave to me was a starting point to really then start understanding and applying theories in implementation science to some of my research interests, and so really helped me formalize research questions in that respect, and that really helped move some things forward as far as funding and research projects. And then I think the other part of training that I had through an NIH Clinical and Translational Science Award was some additional methods areas that I wanted to fill out that I thought were important. So my doctoral training was primarily in epidemiology, but to address some of the research questions that I was interested in D&I work, I recognized that I needed to apply some mixed methods. I needed to fill in some training in qualitative research and also in some system science methods. And that gave me an opportunity to do that as well, which has been really helpful.
Great. Simon?
I would say, I think one of the challenges we have in the field is that the whole premise of becoming an expert is that you become more and more knowledgeable about less and less. And what that means is in a day-to-day world, we don't all read each other's journals. What the tighter program did for me, and what I would urge other people to look not just for tighter, but several of the different offerings, both in, at the institutional level or the regional level, is that it got me out of the disease site organ system specific biases that I think we inherit from how NIH is structured, to realize that for dissemination and implementation, the most interesting piece of science you could be reading about may not actually be in your disease field, that it's funded by another institute happening somewhere else in a different population in potentially a different setting, but they are asking the same kind of question that you're grappling with. And I really hadn't quite wrapped my head around that until I went to tighter and I met folks from very different places doing very different work who were arguing around the same ideas when we got together as a group. And that was really illuminating because they could help you go find the literature that you were looking for. Now that's even more evolved now, as I think that the D&I literature itself and implementation science, the journal, it has evolved. So it's not as difficult, but for me it was really eye-opening. And I think particularly conversations with folks from behavioral health and psychology really helped me think about a lot of the issues that I was struggling with, because they were already thinking about how do they adapt and the challenges of practitioners delivering manualized training in different settings. That really helped me think analogically, and I don't think that would really have occurred to me if I hadn't sort of been doused with listening to people from very different fields coming together within D&I.
Speaking of dowsing, we just wanted to update the campfire pictures for folks. The previous one, just so you know, was not a fire on its sort of uncontrolled, but it was actually, you'll see 4 different fires representing the 4 voices that you were able to see. So now we're down to, there we are. Okay, cool. We are dynamic. So thanks to those of you who have already started to submit some questions. So I'm just going to pull in a few of these. So one of them that I see right here is asking, given, as you've moved on and started thinking about submitting different grant applications, the question for any one of you is how much success you've had with grant applications that have incorporated implementation research that are reviewed outside of DIRH. So do you have any advice or any experiences where you have a D&I related application, but it might be pegged for a different study section where there may not be that specific expertise in the membership? Any of you have any experiences to share or advice to give?
I'd be happy to jump in. My RR1 with my colleague at the School of Public Health here at UT, Bijal Balasubramanian, we struggled mightily because we were definitely on board with the D&I language. We were excited to see the establishment of the study section. We were thrilled to see the PA, and our RO1 did not fare well in that venue, particularly over the key challenge of cluster randomized control trials, which we weren't ready for working in a safety net setting in an integrated system. But it did very well in nursing and related clinical sciences. It had a very meaningful review, I think, thinking very carefully about how you can use NIH Reporter to look at funded grants that match your keywords or match your abstract and look at the funding provenance is really useful because I think there are different goals. David may have other thoughts about that from a sort of program perspective. But I absolutely would encourage people to think distinctly between the methods you're trying to use versus whether you're trying to advance the field, et cetera, and some of those challenges.
Yeah, no, I think. Yeah, please go ahead.
I was going to say I don't have experience specifically with other study sections within NIH, but I have had luck with American Cancer Society. With 2 grants, and I think one thing that was slightly different that I did compared to the an RO1 application to the D&I study section was instead of writing your background section where you start with D&I and then skip to the health issue, I still framed the issue for the ACS application. I started it with the cancer issue, and then I embedded the implementation science piece within that and took a bit more time to define things and use really simple terms that was maybe not as complex as I would have for the implementation science study section. So, and I have mentors and colleagues who've had success with PCORI and AHRQ. So there are other options outside that study section.
And just an overall point, at least that we've learned, is again, you as an applicant do have the ability to take a look at the different rosters and the different themes or the specific objectives of different review committees. And once you submit, the focus, the sort of locus of control at NIH really is with the scientific review officer. And so it's absolutely, you're right, as an applicant to connect with them early on and just ask the questions about, are there sufficient numbers of experts in the key areas of my application on the review committee? Because even up toward the meeting, they do have the opportunity to bring on ad hoc reviewers. And so you might find where if the initial match doesn't quite seem right, and that could be for DIRH where you feel like the clinical or the disease or even the context area might vary from what you see on the review committee or its D&I expertise on those other committees, it often can be helpful to at least ask the question, because I know the scientific review officers work incredibly hard to try and make sure that the reviews have adequate expertise, and they're often quite enthusiastic to get some guidance as to what are the key dimensions of all of these different applications that might need particular expertise. So just another thought for folks to consider. I want to go to another question, which I think came from the recognition that each of you have experience in working with a range of different settings. A specific question just asks, are there specific resources for dissemination implementation, and perhaps that's research, outside of the public health space and more within the acute care setting? Do any of you have any ideas of resources that might be useful if people are thinking about acute care, hospital, et cetera?
I'm not sure what the questioner was getting at per resources. My work is in an integrated health system that's a safety net. It's a public county hospital, so it's not public health broadly lit in the field sense, but it is definitely a tertiary hospital with primary care clinics out in the community. So my work is specifically looking at care coordination between complex cancer survivors and their return to primary care post-diagnosis. And we're struggling with the challenge of patients with a new incident diagnosis when we're starting to track them have slightly different issues of care coordination when they're in active therapy. as opposed to after sort of ambulatory discharge, as it were. But I think D&I maps quite broadly from both sort of community settings, if that's what she's thinking about in terms of public health, and certainly the broad range of work that Katie's leading. But I think it's actively involved in acute care settings, if that's what the question was.
Yeah, I think that's how I interpret it. And of course, you know, the questioners feel free to if there's helpful clarification to provide. I would note that a number of the different dissemination implementation frameworks did arise out of looking at efforts to change clinical practice in healthcare settings. And so it may be that as you start to think about resources related to particular frameworks, that you'll find that there's more connection to particular care settings. But good question, and I think it also underscores what I heard from each of you just talking about. As the field has matured, there's been value in being able to learn lessons from varying settings and apply different models as well as measures as they've been advanced to think about, you know, are they getting at the provider level, at the healthcare system level, at the hospital level, et cetera.
And for our clinical colleagues, I think there's a burgeoning literature in quality improvement, which has become increasingly more systematic and rigorous about their evaluation. I know we all, I think at least many of my ilk, draw a distinction between research and quality improvement, but the quality improvement science is changing and has grown a lot, and there's some really interesting work going on there too. It's aimed at a different audience with a slightly different language yet again.
Great. Let me move on to another question, which and maybe we'll start with Katie and then Rachel, and then finish up with Simon with anything to add. Is there anything that you would have done differently in your doctoral trainings if you knew you were going to focus on D&I at that point? And as a PhD student, what's available to help groom students in dissemination and implementation?
Yeah, so the first part of that question for me is an easy one, because as an epidemiology doctoral student, much of my training was really focused on quantitative methods and analyzing large data sets, secondary data sets, and things that are not really a huge part of my life anymore as a D&I scientist. So I think, you know, as I mentioned, I really sought other ways to fill out some additional methodologies that I felt like I needed to build up to do that work in D&I, as far as qualitative work, systems, complex systems, methods, and systems thinking have been really important to me as far as filling in some of those gaps. And, you know, and again, really understanding the utility and the application of theory in developing a research question and framing an approach to research, which for any of you fellow epidemiologists out there, you probably agree is not a huge part of our core training necessarily. And I'm sorry, what was the second part of the question?
As a PhD student, what is available to help groom students in D&I? So those, I gather, who are interested, while a student, is there anything that you would point to help them get going?
Well, I'm not sure. I would open that question up more broadly and ask you as well, David. But I think, you know, just as a starting point, the journal Implementation Science is a really good place just to start browsing, put in some keywords, see some areas of interest that you have, and see what work, if any, has been done in the field, and how it's discussed, how it's framed, what methods are used. What are the areas of expertise of the co-authors that are on those papers as a starting point? It's one thing that comes to mind.
Yeah, no, good idea. And let me also just say, certainly on NCI's Implementation Science website, we've been trying to curate any number of resources. Implementation Science, the journal, is another good one. Also, if there is any ability for folks to join us in December at what will now be the 10th annual conference on the science of dissemination and implementation, you'll have like-minded individuals numbering 11 or 1,200 at this point. And it's a good way to network because you do have people coming from all different work environments, all different settings that they're interested in, all different populations, and so it's a great way just to get to see the breadth of the field. Actually, Rachel, if you don't mind, there's a question here that I think relates to a comment that you had made before when you were talking about areas that might benefit from further research, and that's, in your view, how does cost or coverage, for example, business models, fit into sustainability? Ultimately, we have to have a way to pay for interventions to disseminate and sustain them. How does this fit into research careers or grants?
I agree, and I think this has been a huge missing issue. I think when you look at implementation science grants, I think people are starting to increasingly add cost as an outcome, but we honestly don't know much, and the cost not only of the intervention, but the cost of the implementation strategies to implement the intervention across different settings. And I think we have the most information about cost probably in the clinical setting. We probably have the least in the community setting. But in terms of the value of sustainability and the cost that's inherent in sustaining them and what the value of that is, we know very little. There's been very little work done on that, and I think that's a huge priority for sustainability research. I think it's been a huge missing piece. The work that I've done is mostly on volunteer-run lay health advisor programs, and this has been a huge issue in terms of what's been able to keep them going is this issue of who's covering it, what's the cost. Even if it is a volunteer program, there still is the cost of the organizational infrastructure, et cetera. So I think this has been a huge missing piece, particularly in the sustainability literature. So we need more work in this area, and I would encourage people to build that into their studies.
Great. Anything else to add, Katie or Simon?
I just wanted to throw in a piece because what I was thinking about as when Rachel first brought up the sort of key question about sustainability is if you are a graduate student or a trainee, if you are looking for opportunities to be involved in studies that are at the implementation stage, that's in your early sort of in the training phase, but when you're trying to think about a K award or an RO3, thinking about how to become involved in a team with an eye to the idea that the piece that is going to be yours will be about exploring a question of sustainability, I think really it opens up I was excited when Rachel talked about it because it opens up a framework to say I can build a relationship while I'm a trainee with an existing site or with a team that's doing work there, but the spin-off for me as I think about my independent research is going to be focusing on sustainability after that implementation piece is over. And I think that's a different way to think about sort of where you're trying to position yourself within a research question that works, but is also feasible in terms of how you develop your career.
Great.
And just as a quick flag for folks, if you are not already following along in the chat, some of the resources or suggestions that are being made, I am definitely moving over into that space. There's a website with our resources, some suggestions about what graduate students can do, the textbook that was mentioned, all of that can be found within the chat, and I'll be continuing to update that.
Great. So I wanted to turn attention to another question that I think would be great to get each of your take on, and that's, certainly we recognize that any of these programs, and we've tried to take a look at across different training opportunities and dissemination implementation research, we have many, many more applicants than the slots that we're able to account for. And so wanted to get a sense, but it's not just that, it's also the fact that a lot of these training opportunities are time limited. So for example, the TIDER course has really only been, a single span of time and it doesn't recur. Some of the other programs might be up to 2 years, but they still may not overlap an entire career. So wanted to ask each of you, and maybe we'll start with Katie, and then Simon, and then Rachel. Following the training experiences that you've had, what types of ongoing mentoring or training did you seek out or receive, or And also, are there suggestions for those of us to think about as far as providing additional support beyond that initial training that you were enrolled in, participated in? Any thoughts about mentoring and sort of next steps for training?
Yeah. So again, I guess I have two kind of separate answers to that. So on one side of the mentoring, at some point I realized that I had wonderful academic mentors, but a piece that I really needed to fill out was having somebody in a practice setting that could also mentor me in other ways. And so when I had some ideas for a project, somebody that I could just, informally toss those ideas around and get some immediate feedback from a practice perspective, but from someone that also appreciated the utility of the research as well. But just to get that immediate feedback on, is this feasible? Is this something that people in the practice community would get excited about, so that I would have some buy-in for the research. So that kind of practice mentorship, I guess, is one way of answering the question. And then so I was really fortunate to have here in St. Louis, there's a group at Washington University that meets frequently and just sets aside a chunk of time every month or so to get people together that are interested in D&I science and to discuss what they're doing, and then have opportunities to review each other's grant proposals and specific aims pages before submitting them. And that has been a really useful resource as well. And is something that is pretty open to just outside of the immediate WashU D&I community, I believe, as well, if anybody's interested.
Great. Simon?
So as an anthropologist, I was trained in the idea that I was going to be a solo researcher and would do everything by myself. And that sort of died quickly when I shifted into the work that I was doing. And so I've become a really big proponent of team science. My expertise is in qualitative methods, and the first thing that I want to do is find someone who has the skills that I am never going to be strong enough in, fast enough in. So my caution to asking about sort of more training is shifting the mentorship side of the question to thinking about peer mentors and the kinds of co-investigators that you want to surround yourself with. I am not going to become a quantitative methodologist. I just need to know enough to ask the right questions and have the relationships with people who do have that skill set. So, by analogy, I think it behooves early stage investigators to be thinking not just about the kinds of training that you want, but the kinds of training that you need just enough to have intelligent, meaningful conversations with people to develop projects where their skills complement your own.
Great. Rachel?
Great. So as I mentioned, in the follow-up period, the training follow-up period, I really did stay in touch with a lot of the people that I met through the TITRE training. I invited people to be co-authors on papers, to review my aims and get feedback. So I actually did a lot working with that initial group of people that I met and kind of continued those relationships, and I actually would send kind of regular emails to mentors that I met through the program where I would say, I'm really developing my work in this. I submitted this grant. Do you have feedback on other steps and other things I could be doing? And I actually found that opened a lot of doors for me and a lot of invitations for other kinds of development of expertise on my end, being a co-author on the textbook and being involved with review papers. So I think really that training really opened up relationships by just staying in touch with a lot of the initial people that I met. And then another piece of that is the peer mentoring. I completely agree with that. So I think within the training, we almost have, a couple of levels within TITRE. We had people who were kind of deans and more senior and people who were more junior. And I think what would be useful is almost to kind of have an ongoing trajectory of people who are more junior and who are, earlier in their career, and people who are more senior, because it seems like we all have different needs. And I've kind of done that informally through kind of, the conference, the D&I conference in December, hosting social events, inviting everyone from TITRE to, to come and meet. But I think there could be a more formal process that would be useful, whether it be a monthly phone call or something where it's kind of an ongoing established chance to kind of connect with people who are at a similar level and just kind of bounce off ideas from each other. So I think that piece would be really helpful in terms of the follow-up of the training and next steps.
Sure. No, thanks. That's great ideas. Wanted to ask each of you, and I think this sort of relates to what you're just talking about, people who in some cases are entering the field and advice you might have for them. So it's sort of a general question. I see, and I'm going to try and pull in another question that we received here as well. And so one is just broadly, are there additional pieces of advice that you have for early career investigators who are thinking about entering the field? And then the related question for that subset who are on the job market and are thinking about D&I research but not sure what institutions are supportive of it, would you advocate thinking about joining an institution that's already saturated with D&I researchers? Would you encourage people to join an institution where they might actually be the lone researcher, which may mean that they don't have as much collaboration, but they might have a niche area? Really broadly, any advice you have for early career investigators, and then anything specifically related to those who are looking at the job market. Maybe we'll start with Simon, and then we'll go to Katie and Rachel.
Sorry, I hit mute. So I think that one of the biggest challenges is trying to think through what's the bite-sized morsel that you are biting off for your first grant application. Because I think that speaking for myself, I think it was very easy to get stars in my eyes and start thinking about really, really, really big projects, and realizing that that's not how, for example, most federal or large agency funding streams work, that the idea is that you are biting off a small piece, so you have the long-term trajectory of your research or the research program you hope to develop, but the smaller piece that you're really thinking about what you are going to accomplish in this grant in the next year and a half is also an approach you can take to thinking about the different kinds of elements you need to build a larger portfolio, and that it isn't going to happen overnight. Once it does happen, it tends to happen a little too quickly. But I think trying to think what the small piece that you're trying to accomplish that you can then build on, because so much of the funding ladder has a structure that we really should be taking advantage of. So thinking about at your local institution what the local pilot funds could be used to apply to develop preliminary data to move to the next piece.
Right. Katie?
Yeah, I think so. Some of my thoughts around that question relate to the fact that it really depends on the institutional context, and part of what I mean by that is, so what is already available, maybe through the institution or through ready collaborators at the institution that will give you that leg up in terms of, for D&I science, partnerships with practice settings. So are there some established partnerships or linkages with certain practice settings via contacts at the institution? And if not, then that's something that you're going to have to build, and that takes some time and energy and resources to do that. And so, making sure that work in terms of developing partnerships with practitioners and practice settings, some of that might involve, providing service, through maybe serving on an advisory board or volunteering some of your time so that you develop those relationships and start giving back to practitioners in a way that they then are willing to give some of themselves to help out with the research. And so, you know, I think making sure that is time and energy that's recognized by your particular institution. And then, you know, I think so. Now, I guess the question, it may be easier to ask in terms of, is there some recognition of an appreciation for D&I science? And so, you know, I think maybe it's easier to open up that conversation now when you're trying to understand some of that context, and whether this kind of work would be recognized and prioritized at your institution.
Great. Simon, additional thoughts?
Oh, I think it's me. It's Rachel.
Hey, Rachel. Oh, whoops.
So, and I agree with that piece. I think that if I were a doctoral student now, I would be trying to learn as much as I could from my mentors about the relationship building process, because I do think whether you're in a clinical or a community setting, that's one of the most critical pieces. And it's often not clear how those partnerships developed, how did they create this network, you know, so I think learning from mentors on that piece will really set people up for success in implementation science. And that's something that I think you have to observe and be a part of to learn from. I think if I were a doctoral student now, too, I would be thinking, again, really strategically about what my niche area is going to be. And I think one lesson I didn't learn is that the titles of your grants and your articles are really important. You know, that you want them to be cohesive and you want to have this area of expertise you're developing. So I have a lot of implementation science embedded in my articles, but I didn't necessarily use that language. So think really strategically, too, about developing, you know, titles that really reflect the program of research that you want to develop in implementation science. And I would also really recommend using conferences. I think I used to kind of hide at them, but I think using them for networking and relationship building, and you know, this field has an incredible set of mentors. I think people are really, really open with approaching them and setting up meetings. I've been completely appreciative of this. So I would really take advantage of trying to meet with leaders in the field and learn from them. And I would have your, you know, at Tighter, we did kind of the elevator speech where you did your kind of 2 or 3 minute speech, you know, if you're caught with a dean or, you know, your department chair and you want to tell them really quickly what your research is. I think having that down in your doctoral program, or at least starting to practice that, will also really help you, you know, clarify for yourself and for others. They'll know you're kind of the go-to person in that area.
Great. Yeah, and I think one of the, there was an additional question that was just asking about, you know, different prioritization among different institutes of D&I research, and I would say that in the same way that often, you know, mentors are surprisingly at times open and certainly happy to talk to anyone and everyone at these conferences, at workshops, et cetera. Also, don't be shy about getting in touch with the different representatives from our NIH institutes who are listed on the announcements to field questions, to give you a sense of what some of those local priorities are. So I want to get to one final question, and you'll see our final campfire set of pictures. So enjoy those. And this has to do with, I think there was a recognition from one of the questioners that funding climates are becoming increasingly challenging. Since you're talking also to those of us at NCI and those of us at the NIH and beyond, any advice you have for those of us funding organizations? What can we do to advance implementation science further? Why don't we get Katie and then Simon and have Rachel finish us off? So your thoughts on that, and then we'll have to close.
I wish I had a really great answer right now. I don't know if I do, but so I guess one thing that comes to mind is as far as, you know, when grants are reviewed, innovation is obviously a really important piece, and I think the way that gets often interpreted is innovation in research strategy. But I think what D&I science also offers is a lot of innovation in terms of the settings and target populations that a study is trying to address. And so maybe, and the types of partnerships, you know, as Simon was saying, team science approaches, so that all of that innovation may be considered more broadly, considering some of those other domains.
Okay. Simon?
I wanted to give a shout out before I answer the question. One is that, you know, as people are, a lot of the questions that have been raised today, David, you and other folks have done a really good job of trying to build up the literature about training and developing a career pathway. Katie has a really great paper from 2013 that addresses some of these core issues. So a lot of these questions are out there and are in Implementation Science or the American Journal of Preventive Medicine, just to pursue if people haven't made those connections in PubMed. When I think about funding, I think, you know, there are key challenges that aren't unique, I think, to D&I, but I think trying to think about where implementation ends and dissemination starts. I've had arguments with colleagues about whether the cart comes before the horse or the horse before the cart. And I think particularly trying to think about funding in the area, obviously investigator-initiated work drives the field, but I think from a convener perspective in terms of producing program announcements and invited issue kinds of things, trying to think about where how we advance the science to make those connections, because there are elements of implementation science, I think, that are not ready for dissemination yet, and vice versa, where some of the dissemination, you know, it's all iterative. So these spirals and whirlpools, sort of eddies and flows, move depending on the application of your question, because if you take an evidence-based intervention in one setting that you're going to learn from and then apply to others, that is both the dissemination and implementation when you move to the next setting, because you have to think about how you implement in multiple settings while disseminating more broadly. And I think that comes back to this adaptation fidelity challenge. So trying to think about where the gaps are is where I am sort of theoretically, that I am still trying to figure out where how the funding can drive some of that.
And I'll just say, so in terms of thinking about mechanisms, I think, you know, it can be intimidating to think about moving from the R03 to an R01, particularly if you need a large number of sites. So I think if funding agencies could build more intermediary, either exploratory or partnership building or mid-level career awards to help address that period where investigators are trying to sustain those relationships and build for that larger R01, I think that would be really, really helpful.
Awesome. So thanks to the three of you, and thanks to everyone who's continued with us even a few minutes past the hour. I'm going to turn it over to Sarah to close things out.
Wonderful. So I'm going to echo my thanks to Katie, Rachel, Simon, and David for their time today. Your feedback is important to us, and we encourage you to complete our online evaluation. A link to the survey will open in a new window once the session is concluded. An archive of today's session will be made available shortly on our website. We hope to see you at our next session held in July. Registration details will be shared in the coming weeks. Thank you again for joining us today. You may disconnect at this time.
And thanks, everybody. That was great.
Thank you all.